I'm a dermatologist and author. Today, I'm going to be talking about vitamin D production. We all need vitamin D, it spurs bone growth. And without it, we'd be at high risk of conditions, such as muscle aches, muscle weakness, bone pain, osteoporosis, and fractures. One way we produce vitamin D is through our skin, which our skin manufactures, when it is exposed to sunlight. The sun's ultraviolet B rays interact with a protein called 7-DHC in skin, converting it into vitamin D3, the active form of vitamin D. The problem is that currently too many people think that using sunscreen and other forms of sun protection lead to vitamin D deficiency, and that the best way to obtain enough of the vitamin is through unprotected sun exposure, but that can lead to a whole other set of serious problems. Vitamin D helps keep your bones strong by regulating calcium levels. In recent years, some proponents of vitamin D have hypothesized that it does everything from decreasing cancer deaths and heart disease to inhibiting type 1 diabetes and rheumatoid arthritis. However, these suggestions are based on observational studies alone. This means that the researchers have observed that people with enough vitamin D have a lower incidence of deaths from these diseases, but not that vitamin D is the reason they're lower. Well, also, relational studies may be a good starting point. They are not proof or a basis for medical recommendations. In contrast, there is an overwhelming evidence for the multiple benefits of sun protection. Controlled studies have shown that regular use of an SPF 15 or higher broad-spectrum sunscreen reduces your chances of developing squamous cell carcinoma by about 40%, melanoma by 50%, and premature skin aging by 94%. It has been proven on the molecular level that the sun's ultraviolet UV light damages the skin's cellular DNA, creating genetic mutations that can lead to skin cancer. In addition, UV radiation harmed the eyes and can cause cataracts, eyelid cancers, and other killer skin cancers. In short, unprotected sun exposure puts you at risk for any number of conditions that can permanently damage your skin, disfigure you, and sometimes even kill you, and the regular use of sun protection can go a long way to keep any of that from happening. High SPF sunscreens are designed to filter out most of the sun's UVB radiation, since UVB damage is the major cause of sunburn and can lead to skin cancers. UV wavelengths also happen to be the specific wavelength that trigger vitamin D production in the skin. Nonetheless, clinical studies have never found that everyday sunscreen use leads to vitamin D insufficiency. In fact, the prevailing studies show that people who use sunscreen daily can maintain their vitamin D levels. One of the explanations for this may be that no matter how much fun's going to use or how high the SPF, some of the sun's UV rays still reach your skin. An SPF 15 sunscreen filters out 93% of UVB rays. SPF 30 keeps out around 97%, and SPF 50 filters out %. This leaves anywhere from 2 to 7% of solar UV be reaching your skin even with high SPF sunscreens. And that's if you use them perfectly. Of course, even committed proponents of unprotected sun exposure recommends no more than 10 to 15 minutes of exposure to arms, legs, abdomen, and back 2 to 3 times a week, followed by good sun protection. That minor amount of exposure produces all the vitamin D your body can. After that, your body automatically starts to dispose of vitamin D, to avoid an overload of the vitamin, at which point your sun exposure is giving you nothing but some damage without any of the presumed benefit. The thing is, even just those unprotected 10 or 15 minutes are way more than enough time to cause DNA damage, and every bit of this damage adds up throughout your lifetime, producing more and more genetic mutations that keep increasing your lifetime risk of skin cancer. The question is then, if not UV exposure, where should you obtain most of your vitamin D? Fatty fish such as salmon, mackerel, and tuna are especially good sources. Small amounts are also present in egg yolks, beef, Liver and cheese and many common foods such as milk and orange juice are fortified with vitamin D. If it is possible, then though sometimes difficult to mix and match these foods to get the daily allowance of 600 international units recommended for the average person. Listen between the ages of 1 and Sunday. However, if food sources aren't enough, you may need to add in a supplement. Remember though, that most nutritionists believe food should always be your first choice with supplements used as reinforcements. The bottom line is food supplements and incidental, protected, sun exposure will give you all the vitamin D you need. Next topic is radiation therapy. I'm Director of Radiation Therapy at Howard University. So, Mr. Atkins, why do we need radiation therapists? Cancer encompasses over 125 diseases. In the UK alone, over 1 million people will be diagnosed with cancer this year. Approximately 70% of cancer patients will receive radiation therapy. The goal of radiation therapy is to eradicate cancer cells while at the same time sparing normal cells because radiation therapy is such an important part of treating cancer. There is a growing need for competent, caring, radiation therapist in all parts of the world. As a medical radiation professional, it can be confronting to experience loved ones going through cancer and radiation therapy, but it is also very important the way that we communicate and deliver education to patients throughout their cancer journey. What inspired you to become a radiation therapist? My career as a radiation therapist is directly linked to my own mother dying of ovarian cancer during my junior years at college. She was diagnosed with cancer when I was a college student, as I accompanied her during cancer treatments over the next 2 years. I learned about the various people who worked with cancer patients. I remember the radiation therapist. He treated my mum. He was a very compassionate man, a good communicator. He was always happy to listen to her concerns and untighten. Listening to him the way he worked with my mum, it had a lasting impact on me. Although I was originally a history major, I came to the realization that my life's work would be working with and caring from cancer patients from this personal experience. I chose a career in radiation therapy. What does a radiation therapist do? A radiation therapist is a valuable member of a cancer treatment team and delivers radiation treatments to patients. Helps my plans and works with cancer patients and their families. Cognitive, psychomotor and effective thinking skills are used every day. When a patient is treated with radiation therapy, they can only receive a limited amount of radiation dose each day. Consequently, it takes anywhere from 2 to 8 weeks for a patient to complete their treatment regime. Because they usually see the one patient 5 days per week for so many weeks, radiation therapists often develop close relationships with their patients. The radiation therapist also needs to be able to plan, evaluate and assess several parameters for each patient every day. The radiation therapist will also assess a patient's reaction to treatment, providing a voice on the side effects of treatment and methods of alleviating these. Can you describe an individual case to us? Well, I recently treated a patient called Susan. Now Susan was quite comfortable in the radiation therapy setting because she herself had previously worked in a radiology practice. She even went as far as to tell me that she felt cared for in that environment. Her husband, however, had a different reaction to Susan's radiation therapy altogether. He found a linear accelerator confronting. He had trouble reconciling radiation dose as a cancer-killing mechanism after all. Doesn't radiation also clean? And thought the advances of science would mean that Susan would not be treated on an imposing machine in a concrete bunker. What would you say is the most rewarding aspect of your career? First, seeing and speaking with patients who are treated 10 to 15 years ago, and having them give me a hug. It's very rewarding. Second, as a radiation therapy teacher, I see the accomplishments of our program's alumni and the many lives they have touched. Careful and help cure. We are very proud of each graduate. The work is noble and greatly benefits humanity. When I teach, I don't only talk about radiation therapy, but I also discuss how the use of radiation can benefit mankind. and improve the quality of our lives, through both medical imaging and radiation therapy. And finally, how do you see the future for radiation therapy and cancer treatment? Well, I think quite a lot about the importance. Research focusing on patients, perspectives and improving the way that we communicate and deliver education to patients throughout their cancer journey. It may well be that patients are nervous or anxious when they present to radiation therapy because they have had a difficult experience in another house setting or perhaps have already experienced chemotherapy side effects. Then there's the issue of patients who have a family and young children. Patients in this situation, faced a quandary in deciding what to tell the children, and each patient manages this experience differently. Many parents want to protect their children from distress, and so do not communicate with the children about their illness, or they give them limited information. However, clear and open communication in an age-appropriate way. It merges strongly across a number of studies, and quality communication between parents and children is associated